How many times have you heard someone say they slipped a disc? Maybe you've even said you've slipped a disc. But the thing is I know you didn't. A slipped disc sounds so bad. That sounds so painful. And you feel like your back is just a stack of blocks that if one pops out of place, you're done for. The thing is first of all, it's an inaccurate term. So let's say you have a bulging disc, right? And so the end of it's pushing out a little. The thing is it probably has nothing to do with why you're in pain right now. And I'm going to get into that today. I'm going to bust one of the biggest myths in healthcare today, especially the one that the back means you're broken, that your back pain means you're broken, or that you're doomed to have surgery. We even know that over 50% of the cases who get surgery come out worse. They come out worse. And years later, they have more problems secondary to the surgery than they do the pain that they had in the first place. This solo episode that I'm going to have today is a mix of a little bit of a rant, a lot of education, and a mixture of real life stories, just little pieces, no patient identifiers, that's going to show you a different and better way forward. Today, we're talking about back pain, and I am Dr. Clayton Dir, physical therapist and the host of today's podcast, Heal Without Harm. Let's get into it. Something that I think a lot of providers don't put enough time and love into is the words that we choose to use. The first one, which I'm sure all of you have heard, and if you haven't, you probably are just like waiting for it, is degenerative disc disease, also known as like triple D or DDD. This sounds horrible. All you picture is this like back of yours just withering away. It sounds terrifying, but all it means is you're going through normal aging. I tell people, imagine a 1984 Camaro and you open up the hood. Do you expect that thing to look brand new? No, but it still functions 100% fine. It just looks like it's been used, or maybe that it's 30, 40, or 50 years old. Another one, we've already talked about it, slipped disc. It sounds like something's out of place, but spines simply don't work like that. At worst, you have a bulging disc or a disc that's herniated, and that is not slipped. And then lastly, my personal favorite is when MRIs show bulging discs that have zero to do with your symptoms. Your lumbar spine has 5 levels. There's 5 bones or 5 vertebrae. There will be people that have pain. They will point to either their hip, their SI joint, their L5, the super low part of their low back. They get an MRI or they bring an MRI in with them, and the only bulging disc they have is at L1, which is 4 levels up, which is sometimes 3 to 5 inches higher than where they're having their pain. That is not the reason for their pain. It just simply isn't. And sometimes those people, unfortunately, are sold the need for surgery at that L1 when their pain had nothing to do with the finding on the MRI. It's almost like they've coined MRIs the new horoscope, vaguely ominous, widely misinterpreted, and often completely unhelpful. It's very, very frustrating. Here's what I want you to remember. You're not broken, but you're being sold a broken narrative. Most of the time, it's not even intentional. Your loved ones around you that are saying you probably slipped a disc, it sounds like a pinched nerve, they don't do anything. They're not meaning that harmfully. And I would even say most of the healthcare system is not being, there's no ill intentions with it necessarily. The thing is a lot of the people in the medical field know how to help people with the tools that they have. And unfortunately, a lot of doctors and surgeons, they know how to do surgery and they know how to take images. But a lot of times I feel like it lacks critical thinking. One thing while I keep going on this is not medical advice. This is research backed, but it's also anecdotal evidence. And I also don't know your specific case. So take this as educational, not medical advice. Let's get back into it. So pain does not mean there's damage. And oftentimes you can have damage even with no pain. I've shut my thumb in a car door before and felt nothing until I realized I did it. They're not always perfect. Imaging also does not equal diagnosis. And more often than not, what your body needs isn't fixing, it's strengthening. They've done studies. Let me tell you this. So they've done a study where they MRI'd a bunch of people with no back pain at all, no back pain. And over 70% of them had disc bulges, arthritis, degenerative disc disease, and other abnormalities on the imaging. So these people are, if all you went off of was the image itself, they would be diagnosed with a problem that sometimes is surgery, injection, medication worthy based off their standards. But they have no pain at all. This is why you need somebody who is going to take all the information into account and figure out what is relevant, what matters to you, and what's actually going to get you to your goals of being strong, moving pain-free, and not being broken. Also, discs, let's say you do have a disc bulge, which is not a slipped disc. let's say you do have a disc bulge. It can heal. It heals. People don't know that because they're not told that. They're like, oh, it's bulged. It's there forever. My toothpaste is coming out of the tube. It's squirting out and I'm done for. My back's done. That's not true. And actually, the worse the disc bulge, the faster and the better they traditionally heal. I also want to let you know, I'm bouncing around here a lot, so I apologize for that. But I also want to let you know that disc bulges, other than a little bit of compromise sometimes to like the strength of the spine, the majority of the time, you can have a disc bulge that bothers nothing because it's only really an issue if that disc bulge is posterior or pushing backwards towards the spinal canal or the nerve roots. So there's a lot of times you can have a disc bulge with no symptoms, no problems, and nothing that you need to actually go and address. I want to tell you a little bit about the new life hack that I just found. It's something called the Whoop Band. It's a wearable health tracker with no screen, just powerful sensors that track your sleep, recovery, strain, and even stress 24/7. I've been using it daily to see how my habits affect my body in real time. It's helped me eat better, rest smarter, shed a couple extra pounds, and stay consistent, all because the data is personal to me. Whoop is offering my listeners at Heal Without Harm an exclusive free month. Just hit the link in the show notes to try it. Let me give you one of my favorite analogies. You have wrinkles on your skin as you get older. We all do. We don't panic about those. We may not like the looks of them, but we're not worried that our skin is totally compromised and it's not going to do its job anymore. A disc bulge is a wrinkle on your MRI. It's just proof that you've used your body, there's miles on your vehicle, and there's wrinkles on your skin. No different. And I also want to let you know, pain is your alarm system, not a broken window. It gets overly sensitive, especially when you've been stressed, when you've been fearful, inactive, not enough rest, not enough strengthening. And so sometimes we can have pain when there's not damage. And I want to let you know, let's say you do have a disc bulge, right? I had a patient today. She told me that she had drop foot and it was actually pain-free. She just started having drop foot and it was due to a disc bulge. That was diagnosed. She didn't have to get surgery. She was worried that she was, and she was sold at times that she may have it. But what she did is she worried about strengthening, decompressing, and she did use epidural injections to get through the pain at the beginning, but it is completely healed at this point. No surgery necessary. However, she was asking why did she not have pain? And then why did she have pain before it happened? And why did she have pain after? And I told her, I said, I want you to think of your spine as a stack of blocks. And between each block is a disc. It's a cushion. Whether or not there's a disc bulge there, if there's an injury of any sort, an irritation, it is very normal for the muscles in that area to spasm, which means they turn on, not within your control, and they're staying in the on position, staying in the contracted position. I want you to go back to that stack of blocks and you put a strip of muscle from top to bottom on the left, top to bottom on the right. And then you contract those muscles and you squish that stack of blocks from top to bottom. That is called compression. That compression is not coming from gravity. It's coming from those muscles being spasmed. And when you compress a joint, it does not feel good. You get pain. And a lot of the times when people point to the spine and they say it hurts here, it's most of the time hurting there, secondary to the muscles around it spasming and causing that compression. So do you want to get surgery for those backbones, or do you want to downregulate and remove that muscle spasm? You want to remove the muscle spasm. That's what's going to actually solve the problem. Surgery, the majority of the time, is not the answer. And the most of the time, the effects that you're going to have to fight afterwards is going to be the effects of surgery, not the effects of anything else. Here's the thing with today's podcast. If anything, I want to bring awareness. I want to let you know that although the back can hurt, the majority of things that are told on social media, among your friends and family, among even some doctors, surgeons, and individuals like that, we all talk about this as if it's this fragile back, and the second it's hurt, you're done for the rest of your life. I have seen numerous patients that have came in feeling that way, walking out having deadlifted 100 pounds on the first day or two, and feeling strong and empowered on their way out. And the most common statement they make is, why did no one tell me this? How did I know this sooner? I wish I knew you 10 years ago. And I say, well, 10 years ago, I didn't know half this stuff because I was still in school. So I'm glad you know me now. But moving forward, the thing is when you start learning where the pain's actually coming from, and that your back is no different necessarily than any other joint that needs to be strong, mobile, moved often, and rested at times, you start to see the back as much less scary of a thing. The thing is I care more about what you can do, how strong you are or aren't, how you treat your back, how mobile you are or aren't, and let's go change those things and see if the reason you came into me, aka pain, starts to go away. The majority of the time it is. So if your back hurts and you've been told it's a disc issue, here's what I would recommend instead. Don't go straight to imaging. Research actually shows that the earlier you get an MRI, the worse your outcomes. I want you to more chase strength. Stay moving, stay active, find a provider that shares your goals that's going to help you get to where you want to be by the means you want to, which if you're listening to this, it means you don't want injections, you don't want surgery, and you don't want pain medications. You want to work with providers who educate and empower you, not the ones that scare you into silence, fearmonger, and make you worry that you're fragile. Rest is not always the answer. Movement is better than medicine, and strengthening is king. You're not fragile. You're adaptable. Let's treat you that way. You need to tell your back, we need to get stronger, but you need to do so at the appropriate dose. The thing is back pain is common. It's real. It may happen to you. It probably will. Most people suffer with back pain at some point in their life. But it's not your identity and it doesn't have to control you. You don't have to go get medications. You can find someone that's going to work with you on your goals and go help you get there. If you are listening to this and you have back pain, you can come see me and we will do half price evaluation. If you know someone that has back pain that you're tired of hearing them talk about it, please send them this podcast. If they come in, they'll get a half off eval. All they have to do is say, I heard your episode on back pain. My friend John sent it to me, and I think this may be the answer. I don't want surgery, but I feel like I'm on that path. I want to try this ahead of time. I want to try this instead. I will give you honest feedback. If I'm not the right person for you, I will put you in front of the right person. We at this clinic want to make sure that you're served best, you're going to get stronger, and you're going to get to the goals that you want. And if this episode made you rethink how you look at pain, please share it. Screenshot it and post it to your story, your Instagram story, Facebook, TikTok, whatever you're on. If you could please leave a review, it'd be foundational for me. I think I've had 2 reviews, a lot of ratings, which I'm actually grateful for, but I would love to hear a review. What do you think of this? You could also reach out to me. Tell me your story. Click on the link in the description below and recommend who you think I should have on next. I think this is really good information that not many people know. And I know that because at the end of our evaluations, they ask why they were never told this. I'm doing my best to tell it. Let's keep people healing without harm. And one of the new things I want to start saying is keep asking questions. Don't settle. So while you're out there, help people heal without harm and keep asking questions. We'll see you guys.